Good morning. How have you been feeling since your last visit? Have you noticed any new allergic reactions or symptoms?
早晨，醫生，我試過避開啲我懷疑會引起過敏嘅食物，但有時食完某啲餸之後，皮膚會痕同埋嘴邊有少少腫。
I've reviewed your blood test and skin prick test results. Your serum ENG levels are elevated, which means your immune system is reacting abnormally to certain proteins in food.
你嘅意思係我對好多食物過敏？
According to your allergen panel, you tested positive for shellfish, peanuts, and egg whites. The reaction to shellfish was the strongest.
我就知道，我上次食蝦嗰陣，喉嚨好緊。
That sounds like a mild anaphylactic reaction. It's important that you completely avoid shellfish from now on. Even small traces can trigger severe symptoms.
我唔應該食同一個鑊或者由煮出嚟嘅食物，啱唔啱？
Exactly. That's called cross-contamination. Even a trace amount of shellfish protein can trigger your immune system.
花生同雞蛋呢？
Your peanut sensitivity is moderate, meaning you should avoid raw or roasted peanuts, peanut butter, and anything labeled may contain peanuts. Peanut traces are often found in baked goods, sauces, and even chocolates. Always read ingredient labels carefully.
雞蛋呢？我食咗好似冇反應。
Your egg white reaction was mild on the test. Some people tolerate well-cooked eggs but react to raw or lightly cooked ones. You can try an elimination diet for 2 weeks, then reintroduce it under supervision.
如果我唔小心食咗會引起反應嘅食物，應該點算？
Good question. You should always carry an epinephrine autoinjector, like an EpiPen, in case of a severe allergic reaction such as anaphylaxis.
未用過，可唔可以教我點樣用？
Of course. You hold it firmly against the outer thigh and press until you hear a click. Keep it pressed for 10 seconds, then call 911 or go to the ER immediately.
有時啲反應一開始只係起紅疹，但之後會覺得頭暈，咁算唔算嚴重？
Yes, lightheadedness can indicate that your blood pressure is dropping, which is an early sign of anaphylaxis. When that happens, you should use the EpiPen immediately and seek emergency care.
如果有一日我真係好想食海鮮呢，我可唔可以先用 EpiPen 再食？
Absolutely not. The EpiPen is only for emergencies. It doesn't stop the allergic reaction from happening. It just buys time until you get medical care. If you deliberately eat seafood, the reaction could still be life-threatening.
有食物過敏真係好麻煩，食乜都要諗清楚， 有冇啲藥或者治療方法可以根治？
Unfortunately, there isn't a medication that can permanently cure food allergies yet. Some research is being done on oral immunotherapy, which tries to desensitize the immune system little by little, but it's still experimental and not suitable for everyone. For now, the most effective approach is strict avoidance and being well prepared in case of an emergency.
所以暫時仲未有得根治。
I understand it can be frustrating, but many patients learn to manage their condition very well. With proper education, preparation, and awareness, you can live a completely normal life.
點會正常？我好鍾意食海鮮同花生醬，細個嗰陣成日食都冇事，點解而家大個咗反而會出現過敏？
That's a very good question. It's actually not uncommon for food allergies to appear later in life. Our immune system can change over time, and sometimes exposure to an allergen repeatedly, like seafood or peanuts, can suddenly trigger an abnormal immune response. Other factors, such as changes in your gut microbiome, stress, or even certain infections, might also play a role in how your body reacts now compared to when you were younger.
我每日都有食維他命同益生菌，我仲可唔可以繼續食，定係要停？怕會影響過敏。
Yes. Actually, some studies suggest that vitamin D and probiotics may support immune balance, but the evidence isn't strong yet. You can take them if your nutrition is insufficient, but they won't replace medical management.
我仲有季節性過敏，好似春天嗰陣對花粉會敏感，呢啲同食物過敏冇關係，係唔係？即係話我平時避開啲食物就得，而春天嗰陣照食平時嗰啲抗敏藥可以。
That's correct. Seasonal allergies and food allergies both involve your immune system, but they're triggered by different allergens. Having one doesn't directly cause the other. So yes, continue avoiding the foods you're allergic to, and during spring, you can keep taking your usual pollen allergy medication.
即係話一年四季都要特別小心，真係覺得好攰。
It can be tiring, I agree. But with experience, you'll develop habits that become second nature, like checking ingredients, asking questions, carrying medication. It'll get easier.
呢啲會唔會遺傳？我需唔需要擔心將來啲仔女都有過敏？
Yes, there is a genetic predisposition. If one or both parents have allergies, the child's risk is higher. But the exact allergens can differ from person to person.
而家揾個好嘅伴侶已經好難，依家仲要考慮將來另一半有冇過敏，變得更難。
Haha, I understand what you mean. Don't worry, allergies don't determine compatibility. As long as both of you communicate and understand each other's health conditions, you can still enjoy meals together safely. Love is definitely not limited by allergies.
而家我已經知道自己對乜嘢過敏，只要跟指示避開嗰啲食物就得，唔需要再返嚟覆診，係唔係？
Not quite. Even though you know your triggers now, allergies can change over time. I'd like you to come back for a follow-up every 6 months so we can review your condition, update your emergency plan, and renew your prescriptions if needed.
"好嘅，冇問題。"
I would like to tell you a few important things before we wrap up today. First, you are allergic to shellfish, peanuts, and egg whites. The reaction to shellfish was the strongest. Your peanut sensitivity is moderate, and your egg white reaction was mild. Second, you should always carry an EpiPen in case of a severe allergic reaction. You hold it firmly against the outer thigh and press until you hear a click. Keep it pressed for 10 seconds, then call 911 or go to the ER immediately. Thirdly, you should always inform restaurants about my allergies every time I eat out. Tell them in advance that you have severe shellfish and peanut allergies. Some restaurants have special allergy-friendly menus or procedures. Thirdly, you should always inform restaurants about my allergies every time I eat out. Tell them in advance that you have severe shellfish and peanut allergies. Some restaurants have special allergy-friendly menus or procedures. Fifth, I'd like to schedule follow-ups every 6 months to monitor your symptoms, review any accidental exposures, and renew your prescriptions. Sixth, I'd like you to keep a food diary. Record what you eat, the portion size, and any symptoms afterward. It helps us identify hidden triggers or patterns. My assistant will give you a template. Lastly, my assistant will print out the summary of your allergy test results and the list of foods to avoid. Also, schedule a follow-up appointment with you. Do you have any questions?
冇問題，多謝醫生。
You are welcome. It's nice seeing you. Wait here.